Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Polio and Post-polio Syndrome. Introduction. Polio is an infectious disease caused by a virus. A few people that have polio will become paralyzed. There is no treatment to reverse the paralysis of polio. Some people who have had polio develop post-polio syndrome, or PPS, years later. There is no way to prevent or cure PPS, but the polio vaccine has wiped out polio in many countries. This program explains polio and post-polio syndrome. It covers the causes of the condition as well as treatment options and prevention methods. Polio. Polio is a highly infectious disease caused by a virus. A virus is a type of germ that can get in the body and make you sick. It can cause irreversible paralysis in a matter of hours. The virus that causes polio invades the nervous system. As it multiplies, the virus destroys the nerve cells that control muscles. Muscles affected by polio are no longer functional. Limbs become floppy and lifeless, a condition known as acute flaccid paralysis, or AFP. Up to 90% of people infected with the polio virus do not have symptoms, or they have mild symptoms that go unnoticed. If symptoms are present, they may include extreme tiredness, fever, headache, stiffness in the neck and pain in the limbs, vomiting. The most severe cases of polio are paralytic polio, which leads to paralysis. Two types of paralytic polio are bulbar polio, spinal polio. Bulbar polio affects the nerve cells of the brainstem. This causes difficulty breathing, swallowing, and speaking. Spinal polio affects the nerves of the spinal cord. It usually causes paralysis that involves the legs. Some people may have both bulbar polio and spinal polio. This type of polio is called bulbospinal polio. Polio can happen at any age, but it mainly affects children under 5 years old. Post-polio syndrome. Post-polio syndrome, or PPS, is a condition that affects some polio survivors. It happens many years after recovery from an initial attack of the polio virus. It can happen 15 to 40 years after the original illness. The cause is unknown. PPS is characterized by a further weakening of muscles that were previously affected by the polio infection. The most common symptoms are a decrease in muscle size, extreme tiredness, painful joints, skeletal deformities such as scoliosis, slowly worsening muscle weakness. Some people only have minor symptoms. Others develop more visible muscle weakness. PPS is rarely life-threatening, but the symptoms can interfere significantly with daily activities and the ability to function independently. While polio is contagious, PPS is not. PPS does not spread from one person to another. Only a polio survivor can develop PPS. There is currently no way to stop or reverse the problems caused by PPS. Some studies have shown that easy, non-tiring exercises may improve muscle strength and reduce tiredness in people with PPS. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. When a person is infected with the polio virus, the virus enters the body through the mouth and multiplies in the intestine. The virus can then spread into the environment through the feces or poop. People carrying the polio virus can spread the virus for weeks in their feces. Food or drink may become contaminated by feces. The polio virus can then spread rapidly through a community. Polio is also spread through direct person-to-person contact. Polio is so contagious that anyone living with a recently infected person is likely to become infected as well. Polio is especially common in areas with poor hygiene and sanitation issues. Diagnosis. Your healthcare provider will first ask about your symptoms and medical history. Tell your healthcare provider if you have traveled recently, and if so, where you have visited. A physical exam will be performed. Your healthcare provider will look for signs of illness. Healthcare providers often recognize polio by its symptoms, such as neck and back stiffness or abnormal reflexes. To confirm the diagnosis of polio, a sample of throat secretions, stool, or cerebrospinal fluid may be collected. The samples are checked for the presence of the polio virus. To diagnose post-polio syndrome, your healthcare provider will look for a history of polio, a long period of time since the original illness, often at least 15 years, a slow onset of symptoms. Tests may also be needed to rule out other causes of your symptoms and to diagnose post-polio syndrome. These tests may include blood tests, imaging tests to look at the brain or spinal cord, muscle biopsy to look for nerve abnormalities, nerve conduction studies which measure the speed of nerve signals. Treatment. There is no cure for polio. Treatment focuses on relieving symptoms and preventing complications. Treatment for polio may include a balanced, nutritious diet, bed rest, moderate exercise to prevent deformity and loss of muscle function, pain medicine, portable ventilators to help with breathing. Antibiotics may also be given for secondary infections. Antibiotics do not treat polio. Treatment for post-polio syndrome is similar to treatment for polio. Physical therapy, occupational therapy, and speech therapy can help you stay as independent as possible. Prevention. In the United States, the last naturally occurring polio case was in 1979. Today, the polio virus continues to affect children and adults in certain parts of the world, including Afghanistan, Nigeria, Pakistan. The spread of polio can be reduced with improved public sanitation and personal hygiene, but the most effective way to prevent the illness is with the polio vaccine. Currently, most children in the United States receive 4 doses of the polio vaccine at the following ages: 2 months, 4 months, between 6 and 18 months, between ages 4 and 6 when children are just entering school. The vaccine cannot cause polio. Common side effects are pain and redness at the injection site. Rarely, the vaccine may cause more serious side effects. Talk to your child's healthcare provider about these risks. In some cases, the polio vaccine may be given in combination with vaccines against other diseases. This means fewer shots for your child. Adults who have not been vaccinated previously may also receive the vaccine. The first 2 doses are given at 4 to 8 week intervals. The third dose is given 6 to 12 months after the second dose. You should take precautions if you are traveling to areas where there is a risk of polio. If you have been previously vaccinated and plan to travel to an area where there is a risk of polio, you should receive a booster shot. Immunity following a booster shot lasts a lifetime.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Polio is an infectious disease caused by a virus. A few people that have polio will become paralyzed. There is no treatment to reverse the paralysis of polio. The polio virus lives in an infected person's throat and intestines. It is most often spread by contact with the stool of an infected person. You can also get it from droplets if an infected person sneezes or coughs. It can contaminate food and water if people do not wash their hands. Up to 90% of people infected with the polio virus do not have symptoms, or they have mild symptoms that go unnoticed. If symptoms are present, they may include extreme tiredness, fever, headache, stiffness in the neck and pain in the limbs, vomiting. Some people who have had polio develop post-polio syndrome, or PPS, years later. There is no way to prevent or cure PPS, but the polio vaccine has wiped out polio in many countries. Thank you for using Explain.